If you came upon an emergency situation, would you know what to do?
Hi, my name is James. I'm a first year. I'm here to help.
Always start with a scene survey. Take charge. Tell the casualty not to move. Call out for help if you are alone. Assess hazards and make the scene safe. Determine the number of casualties, what happened, and the mechanism of injury. Offer to help.
Sir, please don't move. Hi, what happened?
He fell.
You fell? Okay, can I just get you to kindly move back? Sir, where do you hurt?
My head and my neck.
Put on protective gloves. Send for medical help.
You, in the gray shirt, can I get you to call 911? Tell them that we need an ambulance at the arena. We have a person who has a head and neck injury. Can you report back to me? Do you understand?
Yep.
Thank you.
Provide support for the head and neck without changing the casualty's position. Then assess responsiveness.
Okay, I'm just going to come here and support your head, okay? See if you can come and move the bank, please. Slowly. No. Quickly. Okay. Got your head right here. So is this your head and neck that hurts right now?
Yeah.
Instruct a bystander to support the head and neck.
See, can I get you over here and just support the head, please? And overlapping. That's good. Other side too. Okay, great.
Check breathing.
Sir, how's your breathing right now?
Is he having trouble breathing? If you don't get an answer, place one hand on the chest and count breaths. Is the breathing quiet?
Hurt?
Assess circulation to body tissues by checking the skin temperature and condition.
Okay, sir, I'm just going to check your circulation here. It's cool and pale.
Perform a rapid body survey.
I just need you
Begin
to,
with head and neck,
if your head hurts anywhere, okay?
and then move to upper extremities. Run your hands over and under the casualty, continually checking for signs of blood. Check chest and abdomen. Move to pelvis.
Right at your hips.
Move on to lower extremities. Perform a secondary survey only if medical help is delayed, if you will transport the casualty, or if you suspect other injuries. Loosen tight clothing at chest, neck, and waist.
Yeah, I'm just loosening your belt here, okay?
Cover the casualty to preserve body heat.
I'm going to put a blanket over you, keep you warm here. It's kind of getting cold.
Reassess the ABCs, airway, breathing, and circulation.
I'm just going to check the breathing here. Okay. Give me 15 seconds. How's your breathing right now? Just going to check the circulation here.
Protect the casualty's belongings. Don't give him anything by mouth.
Okay.
Record the casualty's condition and any changes that may occur. Also record the first aid given. When medical help arrives, give the attendants an oral report about what happened, the casualty's condition, and the first aid given.
Your name?
In summary, begin emergency scene management with a scene survey. Take charge. Tell the casualty not to move. Call out to attract bystanders if necessary. Assess hazards and make the scene safe. Determine the number of casualties, what happened, and the mechanism of injury. Identify yourself as a first aider and offer to help. If he is conscious, you must obtain his consent before touching him. Put on protective gloves if available. Send for medical help as soon as a serious problem is suspected. If head and spinal injuries are suspected, support the head and neck without changing the casualty's position. Assess responsiveness. Next is the primary survey. Check the airway. A casualty who is able to speak has a clear airway. Instruct a bystander to steady and support the casualty's head and neck. Check breathing. If you suspect breathing problems, assess the quality of breathing. A breathing casualty has a pulse. If bleeding is not evident, look for inadequate circulation to body tissues by checking the skin temperature and its condition. Perform a rapid body survey to look for hidden severe bleeding and signs of internal bleeding. Check your hands frequently for signs of blood. Perform a secondary survey only if medical help is delayed, if you will transport the casualty, or if you suspect other injuries. Give ongoing casualty care until handover to medical help. Reassure the casualty. Cover him to preserve body heat. Reassess the ABCs: airway, breathing, and circulation. Don't give anything by mouth. Record the casualty's condition, any changes that may occur, and the first aid given. When medical help arrives, give the attendants an oral report.
You've just seen the St. John Ambulance Brigade in action. These dedicated volunteers give many hours of service each year, at sporting events, concerts, wherever the public gathers. If you want to put your first aid skills to work, we'll provide the additional training and the tools. You provide the time and the motivation. Make a difference in your community. Ask your instructor or contact your local St. John office for further details.